The reason being that they simply just could not get rid of all the particles that was in our food, or all of the anything that didn't belong there. It was just too much work, too tedious for them to abstract it. So I would like to bring up something, and this happened not too long ago, and I'm sure that it has. This is not just the first time. This has to be reoccurring because in all fairity, I don't want to think I don't want anyone to think that I am against the FDA or the NIH or anything like that. I'm definitely not against them. I'm just simply saying that they are allowing for things to go on that isn't necessary. That's my argument here. Now, between the years of 2001, excuse me, and 2010, there were more than 70 drugs that were approved by the FDA. And those drugs ran into safety concerns, that prompted withdrawals from the market. Might I add, the Trump administration put fire under them to approve these meds. 71 out of the 222 drugs approved in the first decade of the millennium were withdrawn, required a black box warning on the side, or warranted a safety announcement about new risks. Might I add that it took 4 years and 2 months after these drugs were approved and being administered to people in the world. It took 4 years and 2 months for safety concerns to come to the light. Even more alarming, that some of these medications were psychiatric drugs and biological drugs. So now that we have a slight introduction to who is approving what we put into our bodies, and a brief description on how it's being approved, I'm going to share with you my reasons behind the distrust and dissatisfaction for the NIH, the FDA, and the CDER. I simply feel that for companies to be investing so much money, so much time into products, produce, different things that they're marketing out here in the world, if they're spending millions of dollars and their income is billions of dollars, why not take the time out to simply say, you know what, I'm not going to put this out here because I know that it contains things that it's not right for human consumption. Or let's just wait a little bit longer. I know there are some people out here in the world that they would prefer to be the first on the list to take a medicine. And I applaud those people. Like, I totally applaud those people, because without most of those people, we wouldn't know about these medications. We wouldn't know the side effects. We wouldn't know if they work. We wouldn't know if they didn't work. So I really do appreciate those people on the front line that are being the quote unquote guinea pigs for the testing. And they're doing so because it can ultimately save their life, or it can find a cure for them that they're suffering from some type of illness or disease, and they want to be the first on the list. They hear about a new drug and they're like, you know what, I'm at my wit's end. I'll try anything. That's fine, because we do have people in the world that are like that, and I appreciate that. But on the other hand, we have people in the world that are skeptical, afraid, and just wholeheartedly they don't have the knowledge. of some of these drugs that are and vaccines that they are putting out here, administering to people. Now, I did some research and I found out that it takes 6 to 12 years, depending on the disease, to approve medications. It takes anywhere between 10 to 15 years for some combinations of uh, complex vaccines. I also did some research and I found out that some some take 5 years, some take 6 years. But the alarming thing came to me when I found out this year, well, earlier last year, I'm sorry, in 2021, the beginning of 2021, when I started looking up information and it came to me that the FDA is actually putting out drugs and vaccines that have only been tried and tested for 6 months. I'm going to use an example in my family because I don't want to just go out on a limb and say what I think. So I'm going to use an example in my family, and then I'm going to tell you the scenario is that's happening today, right now. So I have a cousin. Well, I had a cousin, and she passed away. She was younger than me. She was 36 years old, and she was She was in the medical field. She had some underlying medical issues as well, but she went and got the COVID vaccine, which was mandatory because of her job. Now, I urged her not to get it. I just don't approve of it because it's not enough known about this vaccine right now, so I don't approve of it. So she takes this vaccine, and within a couple months, she was dead. She died of COVID, which is very alarming to me because I've heard so much in the past 3, 4 months of people dying of COVID within months of taking these vaccines. COVID vaccines, might I ask. So my take is there's not enough information out here. There hasn't been enough evaluation. There's not enough information. And there's not enough testing being done for them to administer this drug, this vaccine.